Other health issues will determine other pieces of your care plan if you need a referral to a specialist after delivery. That should come up before you deliver. This was a study that surveyed moms, pregnant, postpartum women on what are some of the major and minor issues or health concerns they experience during the postpartum period. So the blue is major issues, and then the gray is minor issues, but you can see the large number of women experiencing everything from sleep loss to stress to physical exhaustion to problems with their weight, breastfeeding problems. They get sore nipples or cracked nipples that end up being very painful. They may get infections in their breasts. Some of them experience heavy bleeding, depression, headaches, and they don't have somebody to go back to address these concerns. After your birth, you're going to have to update your care plan depending on how your delivery went. Before you leave the hospital, you want clear instructions on who you call. Who do you call after hours? Who do you call on the weekend? And who do you call during the weekday working hours? Those numbers may be different. You may be expected to do an early follow-up if you had high blood pressure during pregnancy, which can be called preeclampsia or gestational hypertension, because the blood pressure tends to rise in that 7 to 10 days after we go home. And we want to pick that up. So if you don't have a blood pressure cuff at home, then you need to come into the clinic to have a blood pressure check. And so all of that is contingent upon what happens in your pregnancy and what kind of associated conditions you develop during pregnancy. Regardless of even if you have a normal delivery, these are signs and symptoms we tell all patients to keep an eye on, because even patients who had uncomplicated deliveries can develop high blood pressure. And if you don't know that you should keep an eye out for certain signs and symptoms, you won't know that it's time to make a phone call. Same thing that, your partners, family members need to be looking out to make sure they see and are paying attention to the patient's needs, because sometimes the patient may not be self-aware and they need their family members to be advocates for them to get them to the care they need in a timely manner. If you get diabetes during pregnancy, which is called gestational diabetes, you might be someone who is able to control it with diet, or you may end up on medications. Regardless, once we get diabetes during pregnancy, we end up at a much higher risk of developing adult onset diabetes. And so there is a test that needs to happen after we have delivered. And then that test needs to happen every 3 years after that for 10 years, because we are at such high risk of developing diabetes as an adult. And so that testing needs to be arranged, and it can fall through the cracks if you are not proactive about your care and remind your provider that, hey, by the way, I need that test as well. Or if it's your friend or sister or someone else in your circle that you are supporting, that, hey, we need to do that test, which requires you to drink this really yummy load of a sugary drink, and then you have to have your blood tested to see how you handle that load of sugar. Depending on if you develop preeclampsia or gestational hypertension, we are also at higher risk of developing heart disease as we get older. And so again, something for us to be aware of. Also, if we develop preeclampsia, we are at higher risk of getting it in a future pregnancy. And so your doctor may tell you to start a baby aspirin after 12 weeks for your next pregnancy. Or if you end up having a preterm birth, then you may want to talk to a provider or a high-risk OB doc before you plan your next pregnancy, so you know what to expect and what are the risks of recurrence. There are many other things that can happen during pregnancy that probably have some recurrence risk with them. And so just to be aware that if there was some problems, to bring those up with your provider to say, hey, so what does this mean for the next time when I get pregnant? So some of the other common postpartum problems that come up can be pain. You can experience that after your C-section or even after a vaginal birth. If you had a pretty bad tear or any tear, or if you labored for a very long time and you had a lot of swelling in that in the perineal area, that can be really uncomfortable for several days after you deliver. We can leak urine sometimes after we've had a baby, and it takes a little bit of time for that to get better. And there are things that we can do to make it better, including getting a referral to to a physical therapist. It's embarrassing sometimes for patients to bring it up, but it's important so that it can be addressed in a timely manner. You can be taught Kegel exercises that you can do at home. There's so much out there on the internet about these things, but getting the right help at the right time is important. Also, when you are breastfeeding, your estrogen levels are going to be really, really low, which means the vagina is going to be very, very dry, which means sex is going to hurt. And it shouldn't have to. Again, it is something that I counsel both my patients, and if the partners are present, I will include them in that counseling, that it's going to hurt the first time you resume sex, and that the steps that can be taken, including using lubrication, going slow before you resume sex, and not starting it too soon either.